Okay, so we've got a very appropriately titled presentation today, Thinking About Food. So you've all had your lunch, so I hope you're not thinking about food too much now. So what we want to do today is just get you thinking about triggers that maybe cause you to eat a bit much sometimes. This is a model, a systems model, which has obesity at the centre. So obesity is a long-term surplus of calorie intake, which causes weight gain over a period of time. So if you are prone to overeating over a period of time, you will gain weight. But this model shows that there's many factors involved in this. First of all, you've got the food environment that we live in. So we live in what we call an obesogenic environment. Calories have become cheaper and cheaper over the years as the food industry has been able to produce food more cheaply. So you can go to the supermarket and get buy one, get one free offers for all sorts of things like pizzas, etc. And that leads to excess food consumption. There's also societal influences. So you may feel peer pressure, you may feel stress in your life. And quite often one of the things that we fall back on when we do feel stress is to eat, to comfort ourselves with food. And then the activity environment that we're in. So we also can find it difficult to exercise as much as we want to. We tend to lead more sedentary lifestyles these days. Jobs aren't as labour intensive as they once used to be. And also it can be quite difficult to access exercise facilities. So if you live in an area where there's no gym, or you're in a house where you can't have a training machine or something like that, then it can be difficult to do the exercise. With BBS, it's a particular problem because you've also quite often got visual impairment or blindness, and that is a huge problem if you want to do more exercise. And then at the bottom of it all is biology. So does anybody get any suggestions about what we mean by biology contributing to obesity?
Genetic makeup?
So for BBS, it's definitely genetic, yeah.
What, metabolism?
Yeah, so the genetic makeup of a person might affect their metabolism, yeah. The more basic ones are things like sex. So if you're female, you might gain weight more around the hips. If you're male, you might gain more of a beer belly. And also age. So as we go through life, our weight can change depending on. So we do tend to gain weight the older we get, especially towards middle age. So all these domains interact with each other. So you might be feeling stressed about something, and that leads to eating more. Eating more then can make you obese, and that makes you more stressed. So there can be all sorts of feedback mechanisms within this model that can contribute to obesity. So being a syndrome, BBS, people can suffer from what we call hyperphagia to a greater or lesser extent. So some people do not have hyperphagia to a great extent, but other BBS patients have severe hyperphagia, where food can become a constant preoccupation. So the hyperphagia is defined as an abnormally great desire for food, excessive eating often causing obesity. It can be quite common in BBS, and the causes are thought to be an imbalance in hormones, particularly gut hormones. So these promote hunger or satiety. So you may have too much of a hormone which causes hunger, One of these is called ghrelin. There's also another hormone called leptin, which promotes satiety. So these hormones can go up or down, and with BBS, it's thought that the gene makeup can impair the way these hormones work in your body and cause the symptoms of hyperphagia. So treatment at the moment is dietary management, increased exercise, and more recently there's more drug therapies coming on stream. So things like Wegovy, which you might have heard of, or the setmelanotide that we've been talking about earlier on today. So dietary management for controlling hunger. So it has been shown that an increased protein intake, so a meal that's high in protein, promotes more satiety, and also increasing your fibre intake, so having more fruit and vegetables in your diet, and using whole grains rather than just white bread or white rice, that sort of thing. So the reason protein can promote satiety is your stomach empties much more slowly with a high protein diet than say a diet that was just things like potatoes, bread, that sort of thing. And it also these foods also push your insulin levels up higher, so that can make you hungrier as well. So for that reason, we recommend that you try and reduce your portion sizes of carbohydrate foods, especially sugary carbohydrates. Increase your fruits and vegetables, decrease portion sizes, and try to snack less. So having a much more structured meal time can help stop thinking about food in between meals. So try to get into a routine as much as possible and maintain good hydration. So drink plenty of low-calorie drinks, or water. Water is the best drink, so plenty of water. Sorry?
Can I ask you a quick?
Yes, please, yeah.
What about electrolytes? Are you meant to take them or not?
Electrolytes? Most of us shouldn't be short of electrolytes. If you're doing endurance sports and sweating a lot, you might get low in electrolytes, but normally you should be able to get enough electrolytes from your diet.
Because my PT was telling me about them. That's all. I was like, are you meant to take them or not? That's all.
Who was telling you?
My PT.
A personal trainer, yeah. I mean, there's some sports science that suggests for endurance sports that you should top up with electrolytes. You'll see tennis players, when they're getting into their second or third set, they might start to take electrolyte drinks. And it's thought that might help prevent cramps, so it keeps your muscles working properly. Okay. So lifestyle modifications that can also contribute to helping control hunger are good sleep habits. So we talked about obstructive sleep apnea earlier on today. So quite often people with obstructive sleep apnea are also overweight. So that has a knock-on effect of preventing good sleep, and then it has the knock-on effect again of a poor diet because your sleep patterns are very mixed up. Managing stress, so using meditation, stress relaxation techniques to try and control stress and prevent you binge eating because you're feeling stressed. And then increasing exercise, so as much as possible where you can to increase exercise by going to the gym, going out for walks often is also going to help control weight. And it also just keeps your mind away from eating all the time. So if you're very sort of isolated at home, then one of the things you might do is just snack more often. So if you can go out for a walk or go out and do some exercise, it will also take your mind off food a bit more and help with that. So we're going to do an exercise shortly about mindful eating. You've all just had your lunch, so we'll see how you get on with that. And also, other things you can do is seek help or support with weight loss groups, local NHS weight management groups, and also speak to your GP and find out what your GP can perhaps refer you into. So, Emma, do you want to go through this? Yeah. So, the last workshop Emma and I did together, people suggested things that they've been doing in their own life to try and control what they're eating. So one of the things people suggested to manage their portion sizes was to be making batches of meals and freezing them at home in separate containers, so that if they'd made a meal, they didn't go back to the pot and eat more of the meal. It was all frozen and put away, and then they just bring out some the next day or the day after, and that way that helped control what they were eating. Another suggestion was just buying one thing at a time. So instead of buying a 6-pack of Mars bars or a 6-pack of Kit Kats, go to the local corner shop and just buy one Mars bar, take it home, enjoy it, rather than going to the supermarket and buying a multi-pack and eating the whole multi-pack when you get home. Weighing and measuring foods was another suggestion, so you can control the portion sizes that way. That's quite labour intensive, but it does seem to work for some people. And also when the weather is cold and dark in winter time, some people recognise that they might crave more comfort foods, so they might eat the more sort of calorific dense foods rather than the sort of lighter, healthier foods that you might eat in the summertime. Another thing was motivation. So when trying to lose weight, someone said, have something to aim for, such as a special occasion to focus on. Because we're not saying that you cannot eat cakes or desserts at all. Nobody says that. But if you are going to a wedding or going to a party somewhere, then enjoy yourself and eat what you want, really. It's, as I said at the beginning, weight gain is due to what you're doing every day, not what you're doing once a week or once a fortnight. So it's a long-term process. Also attending Slimming World to maintain motivation. So the Slimming World groups work really well for some people. Asking friends or family to help you with encouraging comments. So family support is very important. And notice how when you eat less healthily, you feel more tired and inactive. So stodgier foods tend to make people feel more tired and less motivated, maybe to go out and exercise. Also, somebody mentioned health scares. So getting told by the doctor that getting overweight can have negative consequences. So that can be a good motivator for some people. And you don't necessarily need to diet, you just need to make healthy choices, was another motivator for somebody. Oh, excuse me. And then snacking tips was a suggestion that keeping healthier treats close by, eat something that you don't like before eating, and before eating the nice thing. That way you can work out if you're actually hungry or just want the treat. Not drinking sugary drinks and making simple switches, such as soft drinks, rather than higher calorie alcoholic drinks. And eating before you go shopping was another suggestion, because you're less hungry and more likely to buy what you need rather than lots of extra things that you don't really need. And then planning ahead. So planning ahead of what you want to eat each day rather than eating snacks and unplanned meals during the day. So I think that was all from that, yeah. So.
Yeah, thank you. Is my mic on then?
Yeah.
Okay, yes, I can hear it. So, like Ken said, that was from the workshop we did at the last BBS clinic, and it was in the newsletter, the BBS newsletter. So if you want to go back to those tips that were from you and pulled together by us, you can have a look at it there. So Ken has told us what we should be doing. We're going to have a think now about how we can put that into action. So we're going to start by talking about why do we eat? So one reason, the most important reason, is physical hunger. So we need food to survive, we need food, and we all have physical signs that we're hungry that we then respond to. So some people might feel their tummy rumbling, some people might have different sensations in their body that give them the cue that they are hungry. But if we only ate when we were hungry, we would probably eat a lot less than we do. So there are a number of other reasons that we do eat. One is what we call environmental cues, so things that are in our environment that tell us that it's time to eat. So for instance, there'll be a break this afternoon and there'll be tea and coffee outside. So that is a cue for us to know it's time to have a drink. I don't know if there'll be biscuits this afternoon. So there's meal times, there's snack times that we tend to go and eat, and there's also places that are associated with food. So sometimes people might go to the cinema and then automatically have some popcorn to go with it. We have food as part of lots of occasions, weddings, christenings, parties, birthdays, and those again can be cues that we're going to eat. The other reasons that we eat are what we call emotional eating. So sometimes we might be feeling unhappy or lonely or bored or sad or happy, and those can, for different reasons for each of us, make us want to eat more. Sometimes when people feel very down, they might want to eat more. Some people, when they feel very down, they don't want to eat food at all. So it varies between us, but we do have these emotional cues that lead us to eating. So if you're thinking about food and thinking, I want something to eat, maybe you're not too sure which of those reasons is causing you to want to eat. So it might be that you're physically hungry, it might be that you're in a place where you usually eat and so your body's kind of expecting food, or it might be that you're eating because you're feeling down and fed up and bored. So what we're saying is that it's really important to explore why it is that you're wanting food at a particular time so that you can understand for yourselves your own eating habits. And really importantly, if you can, understanding the difference between physical hunger and this emotional hunger, or these environmental cues that you're having. So one way we can think about this is by thinking about eating triggers. So what is it that starts us off along this route to wanting some food? So it can be to do with events that are happening around us. It can be to do with sensations that are happening within us. It can be feelings. It can be both of those things. So if you're aware of what it is that's making you want to eat, you can be more mindful about why you're eating and whether you should carry on and go ahead and eat, or if you should stop, or even better, plan ahead to work out what and when and how you should eat. So to help you think about what your eating triggers are, you can ask yourself some questions. So why is it that you want to eat or drink? When is it that you want to eat or drink? What is it that you want to eat or drink? Is it at 9 o'clock before you go to bed, you really want a high-calorie snack? Is it, how do you want to eat or drink? Are you wanting to snack all the time, or are you sitting and eating big meals and sometimes maybe overeating? How much are you eating and drinking, and where are you eating or drinking? So if we can recognise what the triggers are, we can start to think about when we might want to change our habits that we're in. Because we've been eating our whole lives, and these are things that have developed over a lifespan. Everybody in here is an adult, so you've been eating for at least 18 years. And these are things that have slowly developed in your life, and you might want to start thinking about, is it when I'm with a particular person I always overeat, and so do I want to do something differently that time? Do I want to plan to do something differently? And what you can do is you can maybe, after you get home, you can look at this recording back, have a think about these questions for yourself, and work on this as an activity for yourself. Think about what for you are your particular eating triggers. Okay. So, right, I've put a diagram up on the screen here, which is called the hunger scale. And it's got kind of 7 blobs going around in a kind of rainbow arc. And it goes from number 1 on the bottom of the arc being starving, number 2 being very hungry or ravenous, number 3 being moderately hungry, 4 being mildly hungry, 5 being satisfied, 6 being full or very full, and 7 being overfull. So we've just all had our lunches, and I'd be really interested to see how people are feeling right now when it comes to how full, how hungry they are. So I'll ask you in 3 sections. So number 1 will be you're feeling starving or you're very hungry. The second one will be you're feeling satisfied. And the third one will be feeling full or overfull. So if I ask you, who is feeling starving or ravenous, could you please raise your hand? Okay, nobody has put their hand up, so that's a good sign for the catering. I guess everybody feels like they had a good meal. Who feels satisfied? Okay, that is most people in the room have put their hands up there. Okay, and who's feeling very full or overfull? Yeah, there's quite a few of us in here who probably ate cake. Who didn't really need that cake. And that is a really good example of an environmental cue, because I probably wouldn't have a bit of chocolate cake after my lunch every day, but it was there. And everybody else was having it, and I was sat next to a dietitian and he had it. So that meant it was okay.
As Ken said, once in a while is not bad.
Once in a while is not bad, exactly. But it does kind of leave you feeling a little bit full or overfull. So I've shared this because it's quite helpful to think about, with your physical sensations of hunger, when is the best time to eat? Is it best to be eating when you're starving?
No.
Is it best to be eating when you're satisfied? Or is it best to be eating when you're full? So depending on how you're feeling, you might end up eating a different quantity. So I think somebody said yes when I said you should be eating when you're feeling mildly hungry. Because then the chances are you're not going to overeat. So I suppose sometimes the problems with diets is that you wait until you're starving and then you overeat, and you've got this kind of boom and bust cycle. So yeah, the best time to eat is when you're not feeling starving, when you're not feeling overfull, but somewhere in between. And the key is to stop when you're feeling full and not going into that overfull. So note to myself there. And what we know for people living with BBS is that sometimes these cues or these hormones that Ken was talking about just now, these hormones that are released that tell you when you're hungry or tell you when you're full, might work in a different way. And so you might feel hungry a lot more of the time than your body needs. And so to kind of get around that, a really helpful thing to do is to plan ahead, because you can't necessarily rely so heavily on these cues of feeling full or feeling hungry. And so if you've got a plan with, like we heard, these are things that you figured out for yourselves because people were talking about doing meal planning, buying one snack at a time. It can be better overall. You can eat the right amount of calories for you if you've planned ahead what you're going to eat across the day or across the week, rather than waiting for the hunger to arrive. Ooh. Okay, so the last thing I'm going to talk about is mindless and mindful eating. So what I mean by mindless eating is when we pick up food and shove it in our mouths without even thinking about it. Okay? I think we've probably all done that. So you're kind of eating it without paying attention to what you're doing. And you probably don't really get to enjoy it as much as you could do. So it might be because you're distracted. It might be because you're bored and you don't have anything else to focus on. And so you're kind of got a bit of an itchy feeling because you're a bit bored, you don't quite know what to do with yourself. And so you might end up just putting some food in your mouth to make yourself feel a bit different or better. So that's what I mean by mindless eating. The opposite of that is mindful eating. And so that's being really fully present and attentive to your food and your feelings and your enjoyment of the food that you're eating. So what we're going to do is we're going to really emphasize mindful eating. Yeah, and we're going to do an activity now where we're going to mindfully eat together. Now, I'm sorry, people who are feeling very, very full, but it is just going to be one segment of a satsuma. So hopefully it won't tip you over the edge, but if you really can't shove it in, then that's fine. And Ken, my glamorous assistant, is coming around now and handing out the pieces of fruit. So we'll just have to wait a few moments until he gets round to everybody in the room. No rush. Well, we're going to be doing that, yes. And we're going to do this very quickly because we've not got much time left. We can do it in 2 minutes. I know, I didn't realise I could fill this much time. Hi.
Hi, can I just invite you regarding this life of diet, healthy diet? Because I've got 2 boys with the BBS, and I think like to balance and to succeed to have a healthy diet, you've got to be stable in your mental health, and this is what's happened exactly for my boys, because he's absolutely depressed and stressed, so he's eating non-stop. He's gained weight 130 kilo when before he has motivation, he still has some size, so he lost all the weight. Now when he lost his size, he said it. I said, it's really dangerous for your health, it's like this and that. He said, I don't care about my health. I'm stressed, I eat because I'm stressed. So when he's like stable in his mental health and he's happy, he doesn't eat much whatsoever. But when he's stressed, he's eaten all the time, non-stop, and nothing can stop him. Nothing.
Yeah, I think, like Ken, I've just put the diagram up that Ken put at the start, because I think that's a really important factor is your individual psychology at the top there. So your mental health can really impact on how your appetite is, where you are, what you're doing, how busy you are, how much you're getting out into the community, how distracted you are. So absolutely, I think these things all really impact on each other. It's not just, but I think one aspect of it can get much more exacerbated at certain times, particularly if you're eating because you're feeling down or sad.
Yeah, because the reason I'm saying this, because in the past he was overweight and he did it by himself. He exercised until he becomes 70 kilos.
That's fantastic.
He has motivation. Now he has no motivation, and this is a thing. To succeed, as I said, he has to be like mentally, and healthy and no stress. This is will succeed more often than using the diet, because this is what's happened with my both boys.
Yeah.
It's by experience. That's what I'm saying.
Yeah. Thank you. Okay, so if you can resist the urge to eat it. I'm going to let you put it in your mouth. Oh, does somebody need another one up here? Okay. So just keep it in your hand for now. If you've accidentally eaten it, maybe put your hand up to get another one. I think we've got plenty. We weren't expecting quite so many people, so we didn't realise it was going to take so long to get everybody a piece of orange. Okay, I think what we'll do, because we're nearly at the end, we'll start with the activity. So I'm just going to be talking through what your instructions, and we're going to be eating this piece of satsuma mindfully. Okay, so we spend a lot of our lives not really being present in the here and now. Life can be busy and our minds can be easily distracted. So now we're going to spend a few minutes focusing on the present by spending time noticing what it feels like to pay attention to eating a piece of fruit. So if you'd like to take the object you've been given and examine it. Okay? So observe it with curiosity. They've eaten it, can you give them more? And look at it as though you've never seen an object like this before. So pretend it's like the first time you've seen it. Study its shape, look at its contours, and if you're able to see it, notice its colours. How many different shades are there? 27 colours. And how many different textures does it have? And notice the weight of it in your hand. And notice the feel of it against your skin. And you can do this activity in your own mind. And run your fingers over the object and notice the way the skin feels, whether it feels smooth or rough or soft. And then raise it to your nose and smell it, and really notice the smell. Feel the object between your fingers. Take a moment to really study it and gently squeeze it and notice its texture. And then, if you're happy to, put the segment in your mouth, but don't chew it. Just roll it around in your mouth. And then notice what's happening in your mouth. Notice the salivation and the urge to bite, but don't bite yet. Okay. Just experience it in your mouth, and then when you're ready, you can bite into it and notice how it tastes. Really notice the texture. And then slowly chew it and notice the sensations as you swallow it. Okay, so even with a small object like this satsuma, we can notice it more by focusing on the present moment. So notice your experience of being with this satsuma in this particular way. And notice how it felt and what you thought about when you were eating in this way. So this is really putting a microscope on mindful eating, but it's something that you can try doing in your everyday life rather than just wolfing food down, taking a moment to just enjoy it in a slow way. And we are out of time, so thank you very much, everybody.